أهلا بكم جميعا في ندوة حوار إقليمي حول السياسات. دي الندوة الأونلاين اللي احنا اتكلمنا معاكم عليها قبل كده. شكرا ليكم جميعا ان انتوا حضرتوا او خصصتوا وقت ان انتوا تحضروا الندوة عبر الإنترنت دي. قبل ما نبدأ أي حاجة، أحب أكد إنه إحنا ممكن نستخدم خاصية الترجمة. هي موجودة على الشاشة قدامنا. هنلاقي موجود في interpretation. I, it can be heard. Okay, I'm just dear explaining that we have interpretation feature. اوكي. فهنلاقي في زرار على الشاشة مكتوب عليه interpretation تحت خالص، اللي هي زي دايرة شبه الأرض كده. والinterpretation ده بندوس عليه وبنختار اللغة اللي احنا مناسبة لينا. So hello everyone. I'm saying thank you all for participating in this event. As we told you and as we promised before that we are having this event. مريم ما تحركيش. We are having this event to present our like outcomes of the MENA Regional Policy Dialogue event. But before we start, we are having the interpretation button. You can see it in the low bar, in the low like taskbar. It's written on it interpretation, and it's like an oval shape. So please click on it and feel free to select the suitable language for you. So I'm just saying the welcome note in Arabic, and then we'll proceed in English, okay? Okay. So just 1 second. Okay, apologies for this, just adjusting our technical setting. So أهلا بكم جميعا في ندوة حوار إقليمي حول سياسات ندوة عبر الإنترنت. أنا اسمي منى الصباغ، وأنا متخصص في مناهضة العنف ضد النساء والفتيات في هيئة كير مصر. ممكن نكون اتواصلنا قبل كده أو حصل بينا تواصل في التمهيد لندوة لفعالية حوار إقليمي حول السياسات اللي تم عقدها في شهر سبتمبر اللي فات. قبل ما نبدأ في التفاصيل وفي الدخول في الكلام على الندوة، أولا بأكد على فكرة الترجمة. يا ريت بالنسبة للحاضرين هنكتب في الشات بوكس، هنحط لينك ممكن نحط فيه بياناتنا، الاسم والدولة والتايتل. لو في أي أسئلة هتبقى عن طريق الشات بوكس، يا ريت تحطوها وتكتبوها في الشات بوكس، ومريم زميلتي مريم هترد عليكم بالنسبة لأي استفسارات بتيجي على الشات بوكس أو بتيجي على الإيميل بتاعها. الباسكود بتاع الويبينار احنا اوريدي بعتناه، فلو في اي حد عنده مشكلة يبعت لنا تاني او يبعت لمريم على الايميل. ده مبدئيا حاجة كمان بوضحها إنه الويبينار مسجل. بعد إذنكم طبعا، ده علشان خاطر بعد كده إن احنا نقدر إن احنا نرجع له، وممكن إن احنا نحمله برضو على اليوتيوب as a reference أو كمرجع للإيفنت دي. آه، طيب، قبل ما نبدأ سريعا، وقبل ما نقول الكلمة الترحيبية للإيفنت، همر معاكم سريعا على الأهداف الخاصة بالفعالية دي. I would like to welcome you all and thank you all for participating in this event and this webinar. It came as one of the recommendations of the MENA Regional Policy Dialogue that took place in Cairo last September. My name is Minna Sabah. I met most of you in the consultations or in the event itself. Kindly note that interpretation Arabic English is available. You can use the interpretation icon on the below taskbar, and then you can select the suitable language for you. Another thing is that kindly note that this call or webinar is being recorded for our reference, and it shall be uploaded later on YouTube or other social media platforms. Before saying the welcoming notes by our colleague Miss Anne, we are having just a few points for clarification, which is to tell you about our objectives of this webinar and also our agenda that we are having for today. So I will complete in Arabic and my colleagues will follow up on interpretation. And please, if you have like any questions, please type them in the chat box or address my colleague Mariam directly on her email. Okay, thank you. بالنسبة للأهداف من الندوة عبر الإنترنت اللي احنا عاملينها النهاردة، هي أول حاجة إطلاق ورقة التوصيات الصادرة عن فعالية القاهرة. وورقة التوصيات متاحة باللغتين العربية والإنجليزية، وهنتكلم عنها بالتفصيل. الحاجة التانية هي تعريف أكتر ببرنامج ما يصلح لمنع العنف ضد النساء والفتيات، وتعريفه أكتر بالمنظمات في الخاصة أو المعنية بحقوق المرأة في المنطقة. الحاجة الثالثة هي نظرة عامة على الأدلة الخاصة بمناهضة العنف ضد النساء والفتيات. وبالنسبة لأهداف الندوة دي قسمنا لكم أو عندنا الأجندة اللي هتبقى كالتالي. أولا كلمة ترحيب من أستاذة آن جاثومبي، هي مدير برنامج ما يصلح لمنع العنف ضد النساء والفتيات. وبعد كده هيبقى عندنا عرض تقديمي حول تقنيات الوقاية أو منع العنف ضد النساء والفتيات، وهتقدمها أستاذة جابرييلا نصيب، وهي باحث أول مشارك في المعهد العالمي للمرأة في جامعة جورج واشنطن. وبعد كده هيبقى في العرض التقديمي عن ورقة توصيات الخاصة بفعالية حوار إقليمي حول السياسات في منطقة الشرق الأوسط وشمال أفريقيا. هتقدمه أستاذة أميرة طه، المنسقة العالمية أو المنسق العالمي للعنف القائم على النوع الاجتماعي في حالات الطوارئ، هيئة كير الدولية في مصر. وأنا هكون معاها برضو في نفس الجلسة دي. لو في أي أسئلة أو عندكم أي استفسارات يا ريت نكتبها في الشات بوكس وهنرد عليها. هيبقى في جزء خاص برضو بالنسبة في كل عرض تقديمي هيبقى
after every presentation, so we can raise questions or discuss some points in case you have any questions. Anyway, you can always leave your questions in the chat box, and later on we can read them and reply. Now, my colleague Miriam would write in the chat box the link that you can leave your data there as participants of this webinar. Thank you, everybody, and I will hand it over to Anne.
Thank you so much, Mina. Thank you for those welcome remarks. Can you hear me?
Yes.
Okay, good. Yeah, thank you. So I'm delighted really to be here this afternoon, morning, or evening, wherever you are calling in from. And it's really my pleasure to welcome you all to this webinar. I think as a follow-up to the consultation that was held last September in Cairo, I want to thank you all for having made time to engage with the WROs 2 program. And as you probably already had, is that the program, which is a 7-year initiative that is supported by the UK government, FCDO, is aiming to find innovative projects that hold promise for generating evidence on what works and supporting them, as well as we have a big focus on scaling up proven interventions that have been found to work to prevent violence against women. And therefore, one of the key things we have done as a program is to prioritize women's rights organizations. And so it's my really delight to be here, to be engaging with women's rights organizations from the MENA region. And part of the reason we've prioritized women's rights organizations is the realization that they do a lot of the work on the ground on gender-based violence, on violence against women. So they have deep contextual knowledge on these issues, and therefore for us to be able to program, it's important that we form partnerships with women's rights organizations. And so really, I'm delighted to see that there's a follow-up to that consultation. I read the recommendations. Unfortunately, I don't speak Arabic. Otherwise, I would have implemented one of those recommendations where you asked us to be to pursue language justice when we engage with people. But I also, in your recommendations, you have said that we should provide translation. So thanks again for the organizers, Amira and Mina, for making sure we have translation here. So really, it's wishing you well in this deliberation. I will not be able to stay up to the end because I have to go to another call that's finalizing arrangements for a meeting we'll be having end of the month. And so I'll be here for a while. Mine was just very simple to welcome you and to say that we really are excited to be engaging with women's rights organizations in MENA region to talk about evidence, to talk about priorities, to talk about the gaps. And so thank you very much.
Thank you, dear. Thank you so much for this. And we are starting another our presentation for Ms. Gabriella Nassif. However, just before we start, we are trying to grant you all the speakers access so that you can also ask questions after each session. Hope that this thing is possible. Okay. Is it applicable now, Solomon?
Yeah, I think everyone is able to unmute and speak if they have a question.
Okay, is it possible for every one of us that we can unmute ourselves and speak?
Yes, Manna.
Okay, great. Thank you so much. Okay, so please, Gabriella, yeah, it's over to you.
Okay, شكرا منى. عم تشوفوا البرزنتيشن هلا أو لا؟
Can you see the presentation now?
Okay, great.
The speaker asks.
مساء الخير ونهار
Good evening.
اسمي جابرييلا نصيف وأنا بشتغل مع Global Women's Institute.
My name is Gabriel Nassif and I work in the Global Women's Institute in Washington. I am very happy to be here to speak about this.
And the team for setting this up. وراح أحكي بالإنجليزي and I'll try to speak at a nice rate so the translation will work. بس إذا عندكم أي أسئلة, please don't hesitate to put them in the chat box and I'll try to answer them as we go. Okay, so As I said, I'm going to
كما
start with
قلت
reviewing the global evidence that's been collected on what works to prevent violence against women and girls. Much of this evidence is based on a lot of the great work that's been done by the What Works project. And after that, we'll move into a look at the Arab region to see what kinds of information and research we currently have available in the region and what we need to try to think about moving forward in our commitments to preventing and ultimately eliminating violence against women and girls. So over the past decade, there's been a significant increase in programming on violence against women and girls prevention, and subsequently research on what works to reduce the prevalence of violence against women and girls. And as I mentioned before, the research that's been produced by What Works has played a really major role in this growing body of literature. And within this research, we see that increasing attention is finally being paid to interventions and programming that's coming from low and middle income countries, whereas before in some of the very first studies, evidence was really skewed towards high income countries. And now within this research, we really need to think about, now that we've been developing this really big body of evidence, we need to think about adapting and scaling up these interventions that have been proven to reduce violence against women and girls. And this doesn't mean that we need to kind of forego innovating new approaches. We need to be doing these two in tandem, right? So scaling up and thinking about how we can apply some of this programming that we now know works to prevent violence, as well as thinking about new and innovative approaches to reducing violence across all levels. So thinking about at the individual level, but also at the community and population levels. So up on your screen, you'll see two of the sort of more recent reports from What Works. The one on the left in blue is the Global Evidence Review of Interventions to Prevent Violence Against Women and Girls. And I'll be covering some of the findings from this report over the course of the next few slides. And then on the right-hand side of your screen, the purple report is an upcoming report by Chelsea Ullman et al., and I believe Chelsea's on this call, which is on practice-based lessons for feminist, ethical, and evidence-based violence against women and girls prevention at scale. So both of these reports, of course, as well as any past evidence reports and briefs completed as part of the What Works program, are available for free on their website. So from this rigorous review of the global evidence, what we see is that one of the major achievements of What Works and the research being done as part of this project is the ability to look across a wide variety of projects from a variety of different contexts to evaluate them. And what we're starting to see is that across their diversity, there are actual themes and trends that are emerging and other types of features that make these projects successful. And so this is what we can see up on the screen in this table. And really one of What Works flagship reports has kind of drilled down into the designs of these programs to identify the key elements that make them successful. And this is what you see written up on the slide. So you can see two categories. There are 10 components of strong interventions overall, divided into two categories: design, which is on the top in the yellow, and implementation, which is the bottom level in orange. So we have 8 areas of design and 2 for implementation. And I'll just try to go over these relatively quickly, but of course, like I said, if you have any questions, please don't hesitate to stop me. So first, one of the components that makes a strong intervention is, and this really shouldn't be too surprising, is thinking about having a rigorously planned program with a robust theory of change that's rooted in knowledge of local context. The program should really try to address multiple drivers of violence against women, such as gender inequity, poverty, poor communication, and marital conflict. And especially in highly patriarchal contexts, we need to thinking about working not only with women and girls, but with men and, where relevant, families and communities. And programs really need to be based on theories of gender and social empowerment. And these are critical because they view behavior change, as a collective action rather than solely an individual process. And they foster interpersonal relations and gender equity. Successful interventions also used a lot of participatory learning methods. And this is for both adults and children, and really thinking about programming that emphasizes empowerment, critical reflection, communication, and conflict resolution skills building. For programs that are working with children, some of the strongest interventions, we're thinking about age-appropriate design for children. So what this might mean is thinking about a longer time frame for learning and engaging pedagogy such as sport and play. So things that really allow children to interact with such a complex issue in a way that's accessible to them. Successful interventions were also, again, probably not surprising, carefully designed. And this really included user-friendly manuals and materials supporting all intervention components to accomplish their goals. And what's important here is that these materials were really, they were well designed because they've been piloted and tested, right? And again, this doesn't mean that we shouldn't try new things or we shouldn't experiment with new guides, but that we need to be very careful before we actually roll out any kind of new training materials in these interventions. And then finally, a key component of effective and successful interventions was that they integrated support for survivors of violence, right? So they continue to kind of foreground the experiences of survivors using this survivor-centered approach as part of their program. And finally, again, at the bottom in orange for implementation, there's two kind of key components here. So successful interventions really had what's been called this optimal intensity. So this is thinking about both the length or duration of the intervention as well as the frequency of sessions. So here you can think about frequency of training sessions or discussion sessions. And again, because we're trying to really enable enough time for reflection and experiential learning. So we know that doing a one and done training for 4 hours in one day is not enough to actually affect the type of long-term change we need to see to prevent violence against women and girls. And then finally, for implementation, successful interventions really had staff and volunteers that were dedicated to seeing, positive outcomes for violence against women and girls. So staff and volunteers were selected for gender equitable attitudes, nonviolent behavior. And of course, they were thoroughly trained. And really what you can see in a lot of the reports is that staff really did their best when they felt that they were supported, right? When they felt that they knew they had some type of backup, during the intervention and then beyond. So moving on, a second flagship report from What Works goes on to summarize everything that's known about successful interventions that have been evaluated to see how they impact violence against women and girls across the entire field. And what this report really kind of signaled is that at this point, and this was the date, it was published 2019-2020, what we can see from this report is that we finally do have a substantial body of evidence to pull from when we start thinking about the types of violence against women and girls prevention programs that work. And more importantly, the fact that we have this substantial body actually allows us to take time to analyze which types of interventions work across different contexts and how we can work best with different communities. So from this report, we can see, and this is you should see it on your slide now, in this table, we can see that there are 9 different modalities of interventions that work to prevent violence against women and girls. And of course, just to continue stressing that these can and absolutely should be adapted and taken to scale. And another key finding is that the report also stresses that practitioners should not see these options here just because they're effective as standalone interventions. Instead, what we really need to do is think of this list as part of a wider portfolio of options that we can look to when trying to assess whether our programming that we're hoping to implement might or will be effective. So in other words, we really should be thinking about how some of these interventions will work together and the ways that we can build what's called multi-component programs. And I will read through these very quickly. So what they found to be effective, of course, when well-designed and executed, intervention types included, economic transfer programs, combined economic and social empowerment programs targeting women, and we'll talk about an example of this later on in the presentation, parenting programs to prevent IPV and child maltreatment, community activism to shift harmful gender attitudes, roles, and social norms. And we will see later on in the presentation that activism and community awareness raising has really been a preferred method of intervention in the Arab states region. However, we want to think about, again, that this doesn't work as a standalone intervention, but that we need to sort of combine it and build it up to become a more robust program model to actually see really strong results. School-based interventions, a few of these were very effective, including interventions to prevent dating or sexual violence, interventions for peer violence, couple-based interventions, including interventions that actually focused on transforming gender relations within the couple or addressing alcohol and violence in relationships. So we're thinking about here really targeted programming that's very purposeful in its selection of participants. And then finally, interventions with female sex workers to reduce violence by clients, police, or strangers. In other words, non-intimate partners through empowerment or collectivization, alcohol and substance abuse reduction. So in this report, while we had that first half of the table where we're talking about really effective interventions, the authors also point out different types of programming that fall into categories that include, they might be promising but require further research. Programs that have conflicting evidence, so that's the orange box on the screen. And then finally, and unfortunately in the gray at the bottom, programs that were seen to have no effect. And here I'll just read a couple of these. So starting up in the top, interventions that are promising but require further research. This includes things like cognitive behavior therapy or CBT, interventions with pregnant women, self-defense interventions to prevent sexual violence for women at colleges, interventions with female sex workers, and economic and social empowerment programs targeting men. In conflicting evidence, again, we see that self-defense interventions have a sort of modeled history of effectiveness, working with men and boys alone. And again, this shouldn't be too surprising, as one of the main recommendations coming out of that first flagship What Works report was that we need to think about working with sort of everybody in the community, and that targeted programming that either works with, men alone or boys alone might not actually see those long-term effects that we're hoping for. And then home visitation programs in the ante or postnatal period to prevent IPV. And finally, programs that had no effect. And again, these were really, as you can see, that first bullet point, this is really good evidence that standalone interventions do not reduce levels of violence against women and girls. Microfinance, savings and livelihood programs, bystander interventions, and brief counseling. Again, these really do not work as standalone interventions. Neither do, social marketing campaigns and edutainment and digital technologies for violence against women and girls prevention. Okay, so moving on. So similar work and research to identify what works to prevent violence against women and girls has taken place, of course, in parallel to and working alongside the What Works program. The Respect Women framework is one example of this work. So it's a comprehensive framework to prevent violence against women and girls, developed by the WHO and UN Women. And it's, of course, endorsed by several different UN agencies, and it's based on the 2015 UN Prevention of Violence Against Women framework. This framework is really action-oriented, meaning that it outlines steps that policymakers, program managers, and implementers and others can use to design, plan, and the evidence for this is available in what are called the strategy briefs, which are available online on the Respect Women website, So we'll just go through these quickly, starting in the top left. The R stands for Relationship Skills Strengthen. So this would include programming with strategies to improve skills in interpersonal communication, conflict management, and shared decision-making. E for empowerment of women, and this looks at, economic and social empowerment strategies. So the S, services ensured. This means ensuring a range of services are available for survivors of violence. The P, poverty reduced. This includes programs with strategies targeted to women or the household with the primary aim of alleviating poverty. The second E in the acronym is for environments made safe. This includes efforts to create safe schools, safe public spaces and work environments, among others. The C stands for
البيئة
child.
التي تصبح آمنة.
Sorry.
I just saw a notification, Solomon, that there is no interpretation. So sorry for interruption, Gabriela. Kindly reassign the interpreters before we can resume the session. Are you with us, Solomon?
Yes, I think it should have worked. I added Maisa. So I don't know if Maisa is online.
I see that the
I am
interpretation
suddenly-
is
I'm online, but I'm not assigned yet.
no,
I just did that,
interpretation in the
so-
session now.
Okay, let me try that again. Give me a minute.
Please sign me as well.
What?
And Mr. Ahmed as well.
Yeah.
Maisa and Mr.
Ahmad.
Apologies. You should start the interpretation. It looks like it has been ended.
All right.
Yeah, yeah, no interpretation option.
Okay, give me a minute. I just sort that out.
Okay, apologies for this. Maybe this is an opportunity that maybe
تبدو
if you
أنها
have
فرصة.
any questions to type them in the chat box. احنا اسفين جدا للي حصل، هي الترجمة الفورية وقفت، فلو في اي اسئلة او اي نقاش موجه لأستاذة جابرييلا ممكن ان احنا نكتبه في الشات بوكس. اعتقد ان الشات بوكس دلوقتي متاح للجميع. لو في اي مشكلة ممكن تبعتوا على طول لينا as a direct message للبانeliست.
So just maybe for okay, give me a minute. I think
Solomon, you can assign me as a host, and I will do that quickly.
Okay, Solomon, please assign Christine as a host and she will
Thank you.
okay, I see that it's already working now. Okay, now we can hear you. So apologies, Gabriella, maybe you can proceed now. Thank you.
Okay, no problem. So just as a reminder, we were here just kind of going over each pillar of the Respect Women framework. So I think we ended with C, which was child and adolescent abuse prevented. So moving on to the last letter T, which is transformed attitudes, beliefs, and norms. So this includes interventions with strategies that really try to challenge harmful gender attitudes, beliefs, norms, and stereotypes. And again, it's really important to stress, right, that none of these 7 strategies should be seen in a silo, nor are they recommended to be used sort of in a silo. They really need to be seen as part of what might be called a system-wide approach to addressing violence against women and girls, and part of these interventions that are multi-component. So I won't go through this slide in its entirety, but it is worth pointing out that for each of the strategies outlined in the Respect framework, there are what are called strategy summary documents, which I mentioned a few minutes ago, that discuss the actual evidence base that was used to build each pillar of the framework. So this table really highlights in a much more, accessible way, instead of making us, dig through each of the strategy summaries, the interventions that were included, what was successful and or promising, as well as what wasn't. And the table kind of documents whether the project was implemented in a high income or a lower medium income country. So you can see across the top, there's the word respect kind of in gray, faded out in the background. And then you have each of the pillars listed therein. And again, you can kind of go down and see the types of interventions that were included in the evidence base for each of the strategy summaries and whether or not these were effective. So here, the orange upside down triangle means it was not, it was ineffective, whereas the green circles and squares mean that these interventions were promising or needed more evidence. And this table here also just presents another overview of the studies included in the Respect framework. Again, just to give you a way of kind of thinking about this from a broader lens in a more accessible way, instead of having to go through each of the strategy summaries. This time, the studies are organized according to the number of reviews in each of the Respect categories, and this is denoted by the size of the circle. And again, the studies that are done in high income versus lower medium income countries. So here you can see that low or medium income countries are denoted by the lighter green color versus high income countries are represented by the dark green. And again, all of this information, of course, can be found on the Respect website in each of the strategy summary documents. This was just to give you all, again, a bit more of an idea of what was included in the evidence base for each of these strategies. So what I'd like to do now over the next couple of slides is just present, two examples of successful programming that were used as part of the evidence base in some of the strategy summaries for the Respect framework. So this program comes from the R strategy. As a reminder, this is strengthening relationships. This program, which was based in Rwanda, was an intensive couples-based intervention that aimed to improve relationship skills and overall, of course, aimed to reduce the gender inequitable beliefs and behaviors and norms that underpin intimate partner violence. So the program here was targeted towards heterosexual couples, from low-income households that were recruited through care VSLAs. So these are Village Savings and Loans Associations. And the activities included a 21-week training period with groups of 15 couples that were delivered by one woman and one man. The curriculum covered things like key concepts like power and gender, rights, managing the drivers of IPV, so including discussions about, alcohol or jealousy. The curriculum also included information about the gender division of labor within the household, maintaining healthy relationships, and ultimately provided an introduction to activism and empowering responses to those experiencing IPV. The duration of the program was 6 months, and it was adapted from SASA, and it was evaluated using a cluster randomized control trial, as well as an accompanying qualitative research component. And the results that came from that evaluation showed that there was more than a 50% reduction in the odds of women reporting physical and or sexual IPV. We saw improved communication between couples and reduced tolerance for IPV. There was a 47% reduction in men's reporting of perpetrating physical and or sexual IPV. And there were indicators of improved relationship quality, better communication, greater trust, and reductions in the number of reasons that were endorsed to justify wife beating. Unfortunately, there was no change found at a community level. So moving on to one of the interventions from one of the E's in the word respect. This is from the first E strategy, which is empowering women. This program comes from Tajikistan. This program is a family and or household center intervention that actually combines gender empowerment with economic empowerment intervention. So again, a really good example of a multi-component program. So the two components included 10 social empowerment sessions, including sessions on, again, key concepts like gender equity, coupled with 10 weeks of economic empowerment sessions on, gender, work, and livelihood strengthening, business development, and income generating activities, or IGAs. And this was targeted at one young married woman within the household, as well as another family member. Each household was also given $370 to start an income generating activity. And this program was relatively long, actually more than 18 months, and was eventually evaluated using a mixed methods evaluation. So again, a quantitative component that included a survey, as well as a qualitative component that included in-depth interviews. And the overall results here showed a reduced IPV 30 months after the baseline survey was conducted. And specifically, it found a statistically significant reduction in all forms of IPV reported by men and as perpetrators, and reported by women as people who've experienced violence. And it's important to note that this will actually be replicated under What Works Too, in the hopes to build more rigorous evidence around this approach at scale. Okay, so moving on. So we've sort of generally covered the evidence that exists at the global level. And now we're going to move on into the evidence that exists at the level of the region. And so here we're going to talk about the Arab League states very specifically, because these are the 22 countries that were included in the single review, the single systematic review of preventive interventions against violence against women and girls in the region. So as some of you might know, in the Arab region, of course, there is far less data more generally on violence against women and girls. This not only includes, evidence about what works to prevent violence, but also the prevalence data, on violence against women and girls. And as I mentioned, in 2023, there was only one systematic review on evidence of successful prevention interventions, and this was published by Owens et al. And on the screen, you'll see just a breakdown of the studies that the authors were able to include in the review. So the study included 17 separate intervention evaluations, but these actually only covered 8 of the 22 countries in the Arab League. And in this review, the authors classified the included studies according to 3 categories of intervention. These are on the right-hand side of the screen in green. So they included primary interventions, which focus on preventing violence before it occurs and includes whole population strategies. So here we might think about legislation or policy efforts, as well as education. Secondary prevention, which looks at early intervention programs designed to detect potential violence against women and girls and targets what we might call high-risk population subgroups or individuals. This type of programming, for example, might include screening individuals for who are believed to be at higher risk, helping to adjust external environments to prevent the likelihood of violence, and of course, working with groups to raise awareness and educate about violence. And then finally, tertiary prevention, which looks at responses or interventions that take place after the experience of violence has occurred. And you can see here the 8 countries, just to reiterate that, include Saudi Arabia, Sudan, Somalia, Syria. Palestine had 2 studies, Tunisia had 2 as well, and Egypt and Lebanon both had quite a few. So from Egypt, there were 4 studies that were included, and Lebanon, there were 5. And overall, you can see at the bottom, unfortunately, the majority of the studies really failed to provide a clear relationship between programmatic or interventional effectiveness and levels of prevention. And we'll go through why and how the authors came to this conclusion. So first, here are just some of the specific modalities that were used by the evaluated programs included in the Owens study. So these included awareness raising campaigns, As I mentioned towards the beginning of this presentation, awareness-raising campaigns around violence against women and girls are really quite popular in the region and were used in a number of studies, not just one or two. We saw one program that included training of formal healthcare providers. So they trained nurses on recognizing and responding to violence against women and girls. Several programs included a component that was similar to awareness raising, but was focused on education about IPV. Drama techniques were used in one program. This might include things like playmaking, or there was one program that had a vignette based on a story from a survivor that was delivered by a well-known celebrity, all to, again, raise awareness about IPV and survivor experiences. There were a few programs that included women's empowerment activities, and finally, counseling. But again, how do these compare to global evidence on effective interventions? As we already know, and as I've been sort of mentioning over and over, standalone approaches like these, and especially awareness-raising campaigns that are just interventions on their own, are not successful in preventing violence against women and girls. And really, this kind of applies to most of the other interventions on this list. We don't really see too many multi-layered or multi-component interventions from the studies that were included by Owens and their co-authors. And again, we know from the global level that what is needed to prevent violence against women and girls is programming that kind of attacks the issue from a broader scale, from different component or using different components. So the findings from Owens et al.'s systematic review is that really global violence against women prevention recommendations are more or less the same in the region. We really need to start thinking about leveling up our programming to include multi-sectoral interventions, multi-component interventions, again, to think about a system-wide approach to violence against women and girls instead of just focusing on an individual level approach. The authors also note that what's really needed in the region is to think about a systems strengthening approach. And what they mean here is, yes, thinking about the community level, but also really thinking about the oftentimes incredibly restrictive policy environment where these interventions are taking place, as you all already know. And finally, the authors really emphasized that what they saw was missing in many of these interventions was a strong theoretical foundation or a strong theory of change. And that definitely what was missing was a gender analysis and a gender analysis not only of the broader kind of contextual environment, but a gender analysis of the ways that programs are expected to work. And this leads the authors into a discussion of some of the kind of overarching weaknesses of the majority of studies included in their systematic review. One of the main weaknesses in many of the studies was that there was just generally an overall lack of evaluations in each of the studies. And in the studies where there were good evaluations, the authors note that the sample size just really ranged. So some studies had a very, very small sample size versus others which had a huge sort of population level sample size. And you can see that the total population sizes that the authors documented ranged from maybe 18 people to 47,545. And of course, that was a much wider household population-based survey. The authors also noted that there might be research bias. So research bias can kind of take a multitude of forms, but one of the ones that the authors really highlighted was that researchers oftentimes were the same people that were implementing the programs, and they were worried that this might have affected, the way questions were asked and as well, the way that the questions were answered by participants. There was also really a lack of kind of research rigor in terms of the methods that were used to evaluate these programs. So here we're thinking a lack of mixed methods, which means evaluations didn't use both quantitative and qualitative methods, but maybe depended on one or the other a bit more, excuse me. And this really, I think, shows up in the smaller size studies where it's based primarily on qualitative work and did not extend out to including, surveys of all program participants, just as an example. And then finally, the authors recognized that there were definitely some sampling and randomization weaknesses. And here again, this is a little bit more in line with what was identified under researcher bias, that because of some of the political and contextual complications of going out and interviewing, high-risk populations, or, interviewing populations that are considered incredibly mobile, like refugee and IDP populations, that this really affected the kind of way that sampling could be done and really affected randomization, which is really important in terms of having a very rigorous study that can prove causality, which is what we're looking for in these studies. I did want to take a moment, however, to talk about one of the studies that Owens et al. Included, which was a what works study, and looked at, combined gender transformation and economic empowerment interventions through a program in Syria. So this was a cash transfer program in Raqqa. And the aim of the study was to understand a bit more about the influence of cash transfers on protection outcomes for women. And this, as the authors of the study note, was really an attempt to address a gap in the evidence on the effects of cash transfers on violence, because cash transfers have been theorized to potentially positively affect rates of violence against women and girls. So the study was the first systematic mixed methods research effort inside of Syria in recent years. So this is really thinking about over the duration of the conflict. And the activities of the project included 3 rounds of multi-purpose cash payments paid out over a 3-month period, excuse me. And for the research component, approximately 456 women were interviewed, and all of these women were part of households that had received cash payouts. And this component was looked at using a survey tool. And then this was followed by qualitative research that included purposive sampling done to identify women to take part in additional in-depth interviews. And the authors note that while the qualitative portion of the study is particularly illuminating, and this is specifically because we see that in their responses, interviewees generally did feel that the cash enabled them to make better decisions in the household and to be less dependent on others. And both of these are seen as protective factors against violence against women and girls. Unfortunately, overall, the study is unable to provide conclusive evidence that cash transfers positively impact rates of violence against women and girls. And as you can see, actually, the main results showed an increased prevalence of IPV at the baseline. Oops, let me go back here. And this is for several reasons. So first, when we look at the global evidence, again, we're reminded that standalone initiatives without an additional gender component are not really successful in preventing violence against women and girls. So here in this case, we see that there was a cash transfer program, and the research to identify its effects on, violence against women and girls came as a kind of secondary add-on component later on. There was no gendered component, if you will, as part of the cash transfer itself. And second, the design of the actual research, which is what the authors in the report do recognize themselves, prevents us from drawing any relationships of causality, which means we cannot effectively say that, yes, cash transfers were the reason that we see, X or Y result relative to violence against women and girls. And this is because there was no control group to compare the results against. And third, surrounding the noted increase in IPV between baseline and endline, what researchers identified is that this might be due to several reasons, but probably foremost because women had developed a relationship with the program staff, who then went on to conduct the research. And what they theorized is that this might have actually created a safer environment for these women, where they finally felt supported enough to actually disclose an experience of violence. And what's important to note here is that, of course, this doesn't mean that the experience of violence that they disclosed actually took place during the intervention, but that this could have been an experience of violence that occurred over the course of their lifetime, that again, because they felt more comfortable with these researchers, they were able to disclose. But I think what's really important here is that the study does indicate that, one, there is absolutely room for more research on the connection between cash transfers and violence against women and girls, especially since, as mentioned in the report, there is evidence from the qualitative interviews that cash transfers definitely can enable certain protective factors from violence against women and girls. Again, this is thinking about more independence, empowerment, and giving women better chances of kind of affecting household level decisions. So just as an overview, violence can be prevented. And some of the key kind of takeaways from the global level evidence is that we need to think about including women and men and engaging the entire community. Really, what's important here is combining multiple approaches as part of a single intervention, and that intensity and duration are important. So here we really want to think about programming that's 6 months kind of minimum or longer, and thinking about addressing social norms regarding the acceptability, of violence. However, all of this really kind of exciting and important evidence-based notwithstanding, there are still some remaining gaps that need to be addressed. Not just in the Arab region, but kind of globally. We need to continue to think about how to address methodological weaknesses, so small sample sizes and non-experimental surveys. So again, this is research that can't really prove causality, which is what we need to look for. There are very few evaluations that actually measure change on a population level. And there is, of course, less knowledge of violence against women and girls in marginalized populations. And unfortunately, and worryingly, there are new types of violence that are emerging any day. So here we can think about technology-facilitated gender-based violence, exploitation and harassment that takes place. And then, of course, the very different types or very specific types of conflict-related sexual violence. There needs to be some more information on the cost effectiveness of these preventions and the sustainability of these interventions, right? So what happens in cases where the intervention is funded by an external donor? What happens after the conclusion of project funding? And then finally, most interventions are group-based and not population-based. And we need a bit more information about sort of the overlap and intersections between violence against children and violence against women. And I'm going to stop there. Thank you very much for listening, and I hope the rest of the webinar will be informative as well. Thanks.
Thank you so much, Gabriela. This is very informative. شكرا جزيلا جابرييلا على العرض التقديمي ده، وهو فعلا يعني في حاجات كتير قوي يعني محتاجة أكتر من ساعة عشان نركز في كل التفاصيل بتاعته. يعني معانا بالظبط 5 دقايق للأسئلة. لو في
minutes
عندنا
for the questions. If you have any questions for Gabriela, we can unmute ourselves and you can just say your question, or you can type your question in the chat if you prefer this way. Anyone likes to raise any question? Actually, MENA, if I can say, there is a question in the chat box. I will read the question and answer it.
Sectoral interventions, can you say something about need for multi-year interventions? How long should you allow for effective interventions ideally? So I think there are plenty of people actually on the call that might be able to better answer this question than myself. But what the evidence definitely suggests, and this goes back to sort of centering knowledge from the context where you are working, it really depends. I know that's not a very helpful response, but it really depends on the group you're working with and the type of intervention you are implementing. I don't know if there are any specific recommendations like that suggest a clear number, like, you want 2 years or 3 years. But that definitely from the evidence that we have, the recommendation is kind of, the longer the better, and the more room for reflection that's given to participants. So this doesn't necessarily mean just, for example, a training session itself. So having multiple training sessions, but that also incorporating into the project room for reflection and room for participants to sort of discuss if and where it's possible, to kind of reflect on the new knowledges that they've learned and, what they can do with that going forward.
Okay, thank you so much, Gabriella. شكرا جزيلا, Gabriella. هل في أسئلة تانية? Do we have other questions? And
Any
Solomon,
other questions?
to everyone so that all of us can read the shared comments. Maybe Gabriella, from my side. Yeah, I just reflecting on what you've already mentioned. I have a question about the effectiveness of the tools of intervention, that they were like classified into groups, one that are known to be the very well designed and the ones that are promising. So how do you really know this, how this is measured? This is one of my questions. The other question is also about the application or the feasibility of applying this research in countries of the MENA region, how this could be applied. That's it.
Okay, shukran, Mana. That's a great question. I think أول شيء, when you look at the studies that have been collected, there are actually a number of indicators that are used. And What Works has developed a set of standardized measurements and indicators to compare results against. So I think that's very important. And I think that's specific to IPV. So that is one of the ways that these studies are able to kind of are being judged for their evidence. And I think secondly, for applying them to the MENA region, I mean, this is such a loaded question. In the study, in Owens et al. Study, that is one of the things they note, is that the variety of kind of political contexts alone in the region make it difficult to conduct a systematic review. And you can't really, it's just a bit too difficult to assess whether a project in one part of the region would work in another. And I do think there is room, as the authors mentioned in their kind of discussion, what we need to think about is developing these and scaling up some of the findings, right? We don't necessarily need to think about, we want to replicate what's been shown to work at the global level, but what is important and what all of these studies emphasize is that they need to be contextualized. So we can change and manipulate parts of them to make sure that they fit the local context and that they fit, they fit the groups that we are working with.
Okay, شكرا جزيلا جابرييلا. بجد.
Thank you very much, Gabriella. Your presentation is really terrific. Now let's move on to our second part of our webinar, which is about the recommendations. I will share my screen.
As introduction for the recommendations paper, this event took place in June in Cairo, This event took place based on a dialogue that was conducted with organizations from other Arab region organizations. We contacted with them with 30 to 40 organizations from different Arab countries, including Turkey. What we wanted is to introduce our work to the program, our program, when we talk about violence against women and girls. This communication took place for about 2 months, from June, July, and August, 3 months. That communication was online. In that period, we wanted to show our projects and tell people how to work more against the violence against women and girls. We wanted to enhance the prevention, and we wanted to enhance the strategies against when we talk about violence against women and girls. Okay, this is number one. Also, based on what took place with consultation with you, we chose a group of societies, organizations, societies. Those societies included 13, 4 from Egypt, 4 from Jordan, 2 from Palestine, and 2 from Lebanon, and 1 was from the northwest of Syria. The workshop lasted for 3 days. The first 2 days was a matter of discussion about the reasons behind the violence, and there were some challenges facing the organizations in the Arab region, MENA, and how to achieve the strategies of when we talk about violence, when we talk about the effective prevention of violence. And we said, and we discussed, how could we be more active in the eyes of the donors, and how the donors could adjust or amend their policies and projects to go or to match with the contexts of the Arab region. Most of all, as you know, each country has its own context and circumstances. Even there are challenges or differences amid each country, not only different 2 countries. This is what we talked about on the second. As for the second day of the workshop, there were about 10 participations from different international organizations, USAID. I'm not going to mention all names. I don't want to miss any of them, but there were many international organizations that they took part with us, in addition to the Embassy of the United Kingdom, Australia, Canada, and there were a number of the embassies were represented, and there was a matter of communication between those international organizations. We came up with a group of recommendation that could be a milestone or the beginning of any body interested in the MENA or the Middle East in terms of violence prevention, violence against women. When we talk about the idea, when we talk about women or feminist organizations, when we talk about the women rights in the Arab homeland. That was the workshop. We held a number of studies, but it was the conclusion based on the expertise of the experts, female experts in the same country, or at the level of consultation. There were skilled people with experience when we talk about prevention, violence against women, when we talk about prevention or response. Or also, there were about 2 or 3 organizations. They attended online. 2 of them were from Lebanon, and 1 was from Yemen. The part I need to address later. Okay. The next slide, I just want to show you the recommendations. These are the recommendations. Amira could take the floor. Amira, please. Thank you, MENA, for this presentation. And I also thank you for facilitating and running this webinar. I just want to add something here to what Amina has just mentioned. MENA has mentioned that was the beginning of our project of what is suitable to prevent violence against women in the north, in the MENA and the Middle East. as this region was not addressed extensively as we were aspiring to in the beginning of starting this project or the program. So the meeting, it was introduction meeting to that program. We had the floor to listen to more, and then we came up with recommendations to when we talk about violence against women and girls in the region. Also, these recommendations came from the program that addresses the region and the organizations, and we could build a vision for the future when we talk about this program to address the organizations and donors and the participants. Based on this, these recommendations are divided into 3 categories to reflect the things that we want to talk. The first one is the recommendation for the program itself. When we talk about prevention, violence against women and girls, to work with the feminist organizations and the women organizations in the MENA and the Middle East. Some of the recommendations that we discussed in the session, just to one of them, to organize a virtual or online session about the evidences against violence against women and girls, and they were organized, and it was mentioned by our colleague Gabriella, and mentioned the international proofs and tools after based on the ending the first phase of the program. Also, the translating the existing key evidences and tools into Arabic, it was a challenge because most evidences were not translated from Arabic into English, and that played a negative role against the program in the MENA and the Middle East. Also, the organization need to make use of this after being translated. Also, when we talk about that, we are working on translating the evidences. We are translating the website in addition to the whole context and contents that were launched earlier. Please go back to the first slide, the slide before one. Also, we wanted to conduct more communication with the donors to invest in when we talk about prevention of violence against women and girls in the MENA, we need to coordinate with women-led organizations to active the ruling pioneering role in prevention the violence and to focus more on changing the social and gender customs and that could increase the violence against women and girls. The next one, she says. Next slide. Also, one of the recommendations that we discussed was to start education group, learning group on and invite the donors to facilitate more the cooperation between the organizations in the MENA and the donors who do not have the opportunities. She is referring to the donors. And when we talk about the women-run organization could have more challenges to reach the funding or the finance aid that could reach them in the areas. Also, we came up with, when we talk about recommendations, we need to find more ways for learning and coordination mechanisms. When we talk about learning process, and we need to start a group of practitioners to prevent violence against women and girls. The next one, if you don't mind. Also, the second group of recommendation was on when we talk about WROs, when we talk about the organizations themselves who discussed the priority and they wanted to come up with this when we talk about the violence against women and girls. What they wanted, what they preferred, she says. And they agreed upon, in consensus, to complete the work in advocacy and support the work capacity of organizations in preventing and responding to violence. And they wanted to adopt evidence-based approaches, and they needed to focus on the capabilities of the women organizations or women-run organizations as part and parcel of the work. Also, we decided to work on adapting evidence-based approaches in VAWG prevention when we talk about the cultural, social, political challenges. Also, we came up with enhance the regional and global networks and how to be represented in the global and international organizations. We did not think only about the global, about the regional. We wanted to reach the international global coordination networks. The next one, the third recommendations was given, sent or addressed, the donors were addressed when we talk about violence against women, to build effective partnerships with, when we talk about WROs in the region, when we talk about women organizations or women-led organizations in the region, including the recommendations to understand the local context, local conditions, traditions, and it is not a new idea to be discussed, but we needed to know more about the local traditions to share and engage other local women-led organizations as an effective partner to listen to and to reach the marginalized women in those areas. It shouldn't be a matter of only, we need it to be reciprocity relationship, not only to invest. We need to focus in this relationship with those women, to focus on the experience of those organizations, women organizations and women-led organizations, and we listen to their role in fighting the violence, and they understand more, and they are more oriented about the local conditions because of the language and because of the traditions and the ways of reaching and addressing women and girls in those local areas. Also, international organizations and donors, we need to use Arabic language when we address the women rights organizations. Many incidents are taking place, and when English is used, how can we work more on events in which Arabic language should be used to facilitate the work to reach and address the largest number of women and to represent them in those platforms or in other meetings. Also, we wanted to map or draw a map of the services. It could be an effort that needs a lot of financial aid, and it needs a lot of time and dedication, because there is a point, the donors, they think that the donors can help them with the governmental, in cooperation with the governmental bodies, and then they can draw a map of services to enhance the work when we talk about violence against women, preventing it. They also wanted to focus on building the relations and enhancing the reach. It is not a matter of donors. It needs to be reciprocity or sharing, dialogue taking place between the donors and the international organizations and human rights or women rights or women-led organizations. It needs to be, the partnership needs to be deeper, sharing expertise. It's not a matter only about giving money or financial relations between the donors. The donors are just giving money and the local organizations are beneficiaries. It's not a matter of giving and receiving. Also, some of the recommendations to the international donors and organizations. It needs to be flexible, sustainable funding. When we talk about short-term funding process, a short one, it could be not flexible in its policies and in the requests or demands. And this financial aid or funding needs to take into consideration the challenges that could face the women organizations and women-led organizations. These challenges differ or increase and could be added, not like those challenges facing the civil society organizations. Also, accountability and follow-up. It's very important matter. When we talk about the international organizations, there needs to be cooperation, and we talk about the technical support and donations to the local organizations who are working on prevention, the violence against women, but those are not held accountable or followed up to know that those organizations are meeting or observing what they already promised and discussed earlier. Also, there is also, when we talk about the maintaining and enhancing the regional relations, they need to include regional and national relations, because the national partners are partners with us. We need to build the development. They need to set the strategy of its system strengthening for the organizations in matter of exit or outlet. When we talk about the local services sectors, in short, there needs to be cooperation with the regional and national partners to be more comprehensive, more effective to prevent violence against women and girls. And the last thing is safety and risk mitigation. And this was a request by the international donors. This needed to be taken into consideration, not when we talk about prevention violence, but also in the prevention as a whole. When we talk about the risks of violence against women and girls, this safety and risk mitigation needs to be an important part of the programs to be more comprehensive in the region indeed. This was part of the recommendations discussed in our workshop MENA talked about, and the report is available on website in the and MENA, my colleague MENA will share it with all partners. It's going to be available in Arabic and English, and it's going to be available on our website and through email. Any questions so far? If you have any questions, I am available, whether on the recommendations or the coming steps of our programs. Thank you, Amira. We have 1 minute. We have 1 minute. We could take one question or last comment or apologize because we are short of time. If you need to give any feedback, could I share? One of the speakers asks. Yes, certainly. Sorry, my voice. I am sick. I have two comments on the recommendations. The first one, when I could not see the role of universities and universities play a very important role.
The research, the good research, a rigorous research are coming out of universities. The second recommendation, or second comments, the presented recommendations for me, actually, it's what work to keep the organization going on, not what work to prevent violence against women. What presented, this presented recommendation, this is what I get a message from. So I hope that the other recommendations is really about what works to prevent violence against women. Thanks.
Thank you dear. يعني I can ممكن أرد بالعربي.
I
هو
could reply in Arabic. When we talk about the recommendations about universities, we discussed them in the same paper, but we did not mention them in detail. The details could be elaborated if someone wants to elaborate in other events or sessions, or there could be supplementary part of that event. But we talked about the role of universities and the stakeholders. When we talk about the scientific and academic research, we address that issue of the universities. Also, your point of view is about the sustainability of the work. We talk about societies on women rights. Now, I need to prevent violence against women and girls, so I support these societies, organizations, because they are the mouthpieces of women against this violence. So that was the purport or the goal, the objective of the meeting. I hope I've answered your question. Any more questions? Any more questions? As we have passed the time with 1 minute 31. Any questions so far?
Okay, so I actually see that we are, yeah. Okay, so any other questions؟ في أي أسئلة تانية أو في أي تعليقات تانية؟ Kate?
Any questions? Any more comments? Kate, do you need to add anything?
أميرة؟
لا شكرا منا شكرا
Thank you, Mina. Thank you very much indeed.
شكرا جزيلا ليكم وشكرا على حضوركم النهارده، واحنا هنبعت لكم بالايميل ورقه التوصيات تقدروا ان انتوا تدخلوا
Thank you for
عليها.
attending, and you are going to, we are sharing this with on email. You could reach it and you can share more ideas if you have anything to add. We thank you all for all speakers that contributed to this